Chaiban, UNICEF Deputy Executive Director for Humanitarian Action and Supply Operations. Welcome to Al Arabiya, sir.
Thank you.
I understand that you are speaking to us from Port Sudan, and we are grateful that you're sitting down with us in this special Diplomatic Avenue episode on the war in Lebanon. So thank you again. I would like to start by asking you about the Paris conference yesterday, and that raised more than $800 million and more than $200 million for the Lebanese army. The 800 is for humanitarian purposes. Is this amount, in your expert opinion, enough to stop the bleed in Lebanon?
Well, firstly, I think we need to appreciate the support and the solidarity that the world is showing to Lebanon. But what will stop the bleed is an end to the conflict. We need a ceasefire. We need implementation of Security Council Resolution 1701, and for the Lebanese army to be able to deploy on the national territory. The money will help. The money will help. I was in Lebanon last week, and what we saw was devastation. Devastation, 1.2 million people on the move, displaced from homes that they can no longer go back to, of which 400,000 people, and they're living in shelters on top of each other, 1,000 people in a school with 12 toilets for 1,000 people. So the humanitarian funding will help, and of course the funding available for the Lebanese armed forces will also help, so that it can play its role in implementation of Security Council Resolution 1701.
On this point about your visit to Lebanon, I'd like to ask you, are we witnessing another Gaza in the making?
Look, there's no doubt that what we're seeing is destruction, people on the move, evacuation order, health workers that have gotten killed. Over 150 health workers have either been killed or injured. And what we're seeing is a level of fear, a level of anxiety that is devastating to Lebanese children and their families. And in that regard, it does remind us that conflict hurts children first. That's been the case in Gaza. It's the case today in Lebanon.
2 million people, including 400,000 children, have been displaced by this war, and 190,000 children have been forced into overcrowded makeshift shelters. Can you tell us what's UNICEF step by step doing to help these families in the shelters and those also who are staying with families and relatives and have children?
So firstly, has been to work with a number of partners to provide psychosocial support to the children. Just simple play activities or activities where they can speak to counselors and talk about their feelings and try to get a sense of security and normalcy. Some have lost loved ones. All have lost their homes or cannot go back to their homes currently. And they feel a profound sense of insecurity, of fear. And by playing with them, by having discussions, by letting them be with other children, we can restore a sense of safety, a sense of normalcy, and extend that support to their parents as well. Second is the provision of water and sanitation facilities. Each of those shelters needs water every day. We're also looking at solutions that try to expand the number of toilets in the schools and provide showers, because the schools were not designed to house up to 1,000 people. They were supposed to be there for students, only there during the day. So we are working to systematically go. We've committed to do this in 500 of the 1,000 shelters and provide water and sanitation solutions. Third, we're working to connect these shelters to the nearest primary healthcare center. This is something we're doing with the Ministry of Health. So a mobile team comes to the shelter and provides health services to the children and their families.
What are you doing to provide education for children in Lebanon in badly affected areas?
So the population has moved from those affected areas. We estimate there's still 30 to 40,000 people still living south of the Litani, but the vast majority of people have moved to areas further north in search of safety. What we're doing is firstly starting with temporary learning activities in the shelters. So again, for an hour or two a day, do some kind of very basic learning to have children continue with the sense of some kind of education. But we're also working with the Ministry of Education and other partners to look at the schools that have not been turned into shelters, or if that's not possible, in municipalities where all schools have been turned into shelter, trying to vacate one of the schools so that that school can become the magnet for education for all of the other children that are displaced and those that initially depended on that school. And then do several shifts. So do 4 to 5 shifts to try to catch up the children with their learning. That's a plan underway. As I said, private schools started already earlier this month. And the idea is that by early November, we can resume some form of learning for as many children as possible.
Hundreds of Lebanese children have already been wounded in this war. Is there anything that can be done to ensure parties to this conflict adhere to international humanitarian law?
155 children have been killed since the 23rd of September. Almost 1,100 children have been wounded. It's mind-boggling. My colleagues were today at a burn hospital in Beirut that had to triple its number of beds. The parties need to respect international humanitarian law. Their responsibility is to protect civilian and the civilian infrastructure on which they depend, the health centers, the shelters, the school. And there needs to be respect of international humanitarian law. Ultimately, what the country needs is a ceasefire. But in the lead up to that, in the context of war, parties have a responsibility. They have a responsibility to protect civilians and civilian infrastructure. You cannot be hitting hospitals. You cannot be hitting ambulances. You cannot be hitting schools and shelters. And you need to take care to protect civilians and civilian infrastructure, even when they're living in their own homes and residences.
How does UNICEF reunify children who have been separated from their parents, and how many families have been affected by this?
So altogether, over the period of conflict, we also have to remember this conflict did not start last month. It's been 30 days of madness, but it's been a war that's been ongoing for over a year. And altogether, at different times in the process, there were 69 children that were separated at some point or another from their families. They have been reunified by and large with their families. There's another concern, which is a number of Lebanese and Syrian families, primarily Syrian, are crossing the border from Masna'a into Syria. It's about 300,000 people, of which 70% are Syrian, 30% Lebanese. And what we do there is we provide a bracelet to the child as they're crossing the border with their name, the name of the father or mother, and a phone number. So if they get separated from their families in the movement across the border, there's a number that can be called so that you can get them back together. But these are some of the measures that we take to try to reunify children with their families.
How does UNICEF handle the needs that escalated from the needs of 100,000 Lebanese to over 1.2 million? Many of them are children in space of days.
So we had done scenario planning, and we had certain preparedness measures. We had pre-positioned supplies. We were ready for a certain level of escalation. But what we're seeing is beyond what was anticipated. The level of destruction, the level of displacement, the pain that children and their families are feeling is beyond what can be expected. And so we're doing everything possible to respond to the immediate needs. We're undertaking missions down also to Tyre and Nabatiye and Rashaya and other areas in the Bekaa to reach those people who are still remaining in those areas. But what is needed very clearly is more resources, more access, and frankly, an end to this war.
A ceasefire.
We are a ceasefire. We are absolutely terrified, but by the notion that this could go further than where we are today, because the country is straining. I mean, when I was in Lebanon with my colleague from World Food Program, Carl Scow, last week, we saw communities being there for each other. And as you know, Lebanon has fault lines, but across sectarian lines, across religious lines, people were there for each other. But the place is straining. And there absolutely needs to be a political way forward and a ceasefire.
You said to me that the Lebanese communities banded together for the time being to help each other as much as they can. What if the war continues for an extended period of time? As a Lebanese yourself, how concerned are you about the tension that began to rear its ugly head among the different communities in Lebanon? Or do you have full faith in the Lebanese that they will stay united in this crisis and rise above sectarianism?
Look, I mean, the first thing I want to say is how impressed I was by what I saw. I mean, we met two families from the south who were in a home in Mount Lebanon over Beirut with a colleague, a business colleague of theirs who's from a different community. She gave them 2 of the 3 rooms in the apartment where she lived. We were in Zahle, and we saw people managing schools who normally have children from another community, again welcoming children from the south. So let's first say the solidarity of the Lebanese has been fantastic and remarkable. But we also know that, in a country at war, in a place where there's violence and destruction, where you fear for your own family and your own security first, tensions arise. Even if your own brother or sister came to stay with you, you can do it for a month, you can do it for several weeks, but at some point it becomes a strain on everybody. So again, both the Lebanese government and its partners, including UNICEF, are aware of this. And we're looking at measures to support not just the families in shelters, but also the families that are living in communities, and try to do this in a way that's equitable so that people benefit. One of the issues with making sure that education resumes is that everyone has a chance to get back to school. So again, those kind of tensions don't arise. So we really need to plan for the best, work in a way that enhances those communal links while recognizing that those tensions in times of war are there and we need to manage them.
How much concern is the danger of waterborne diseases for children in particular?
Look, thank you for asking that. I mean, there was an actual case of cholera in the north of the country. It was found and isolated, which is the right thing to do. But this is one of our biggest concerns. UNICEF has been working with the 4 water authorities that exist in Lebanon. They're geographically distributed north, south, Mount Lebanon and the Bekaa. And part of what we do is support the functioning of these water authorities, with generator, water pipes, fuel. So it's a partnership between government and UNICEF to keep, and a number of donors to keep those water systems going. That's the water that's being trucked or provided to these different shelters, or indeed to communities, and we need to sustain that work. So it's absolutely essential that we keep working on that we also work with the Ministry of Health on public health measures. When you've got 1,000 people in a school with 12 latrines, people on top of each other, you need to maintain tight hygiene. So there's a number of steps being taken, but it is a risk, and it's something we have to watch out for, especially when the health system itself is under attack. And again, we go back to the point that one needs to respect health institutions and international humanitarian law.
You spoke about 30 to 40,000 people, many of them are children, still remain south of the Litani River. Are there any plans to extract them? And to what extent does deconfliction work in this case?
So there have been some extractions. There is a process of deconfliction. As I said, there have been missions by UNICEF, World Food Program, and other agencies down into those areas. But it's also a question of choice. Some people don't want to leave because they want to stay next to their homes and they want to make sure that those are secure, or frankly, because they have elderly parents or relative and those don't want to move and they're afraid that if they do move, they will, face from a psychological standpoint so much pressure that it may affect their health. So there's a number of reasons why people stay sometimes in these places. So we both need to support those that have moved, but also continue to make efforts to reach those that stay behind. And I have to tell you, I'm very proud of my UNICEF and my WFP colleagues for taking those convoys all the way down to the border with Israel to try to reach those people in need.
UNICEF was active in Lebanon before the war started in the 23rd of September. We understand the war has been going for a long time, but the actual bombing, etc., started in the 23rd of September. But will UNICEF be able to continue with the pre-war work that it used to conduct in Lebanon before the war and keep up also with this emergency?
Look, when I was in Lebanon, I said to government, I said to our partners, UNICEF has been with you, UNICEF is with you, UNICEF will be with you. We will continue to mobilize the resources, both so that we can respond to this war, but also so that we can continue some of the very important work that we did before. And what's important also to note is that what Paris did yesterday was raise the resources for the immediate response. But there will be a whole process of recovery and reconstruction. And we need to be there for the Lebanese. They did not ask for this. We need to be there for the Lebanese.
Chaiban, UNICEF Deputy Executive Director for Humanitarian Action and Supply Operations, we thank you for this interview and we thank you for your insight and wish you the very, very best of luck in your good work for the benefit of children all over the world, and in this case in Lebanon. Thank you, sir.
Thank you. Thank you, sir.